The next exercise we're going to do is wall walks, which is really important, in particular post-surgery or treatment post-breast cancer, but again, can be done with just stiffness of shoulders. And we're going to show what's called scapulohumeral rhythm, which means how the shoulder and the shoulder blade work together in order to raise the arm up overhead. And after you've had any kind of chest wall surgery or even a shoulder surgery, this can get disrupted. So we're going to demonstrate on Christina, whose left side was affected by breast cancer, and she has some remaining tightness that she works on that side. So as she slides her arm up the wall, what should happen is the shoulder blade should turn and help rotate so that the arm is able to reach up overhead, and then sliding back down. And again, see this, the rotation of the scapular shoulder blade to allow the arm to raise up. The whole mechanism, the way our humerus fits into our scapula, it works much better when we are able to move. And a lot of times that gets weak. You can see a little bit on her, she's got a little weakness of her shoulder blade, so it wants to kind of come off the wall here. So we want to think of it sliding down and rotating up as she raises up. There shouldn't be any shoulder pain here. And again, our goal with her is to get nice range of motion and get her to a place where she feels a stretch, but she also has stability. She's keeping her shoulder, show them, Christina, if you could, raising your shoulder blade up as she raises, instead of trying to keep that shoulder blade down in that space with the neck. This is also really good with neck and shoulder combined problems. As she raises her arm up, and let's have her turn to the side, and we'll show how. In here, we want to keep that scapula down, those ribs, tummy, pelvic floor lifted as we raise our arm up, and keeping that nice stability in the shoulder, and maybe feeling a stretch through here as her arm is on the wall as she works. So coming down, and you can kind of say to yourself, let me walk my way into the wall. And then it's about opening, feeling that white light and opening instead of forcing this movement, just releasing. It really is about releasing and opening without pain. We're going to show you the difference of her side so you can fully appreciate how this might affect one side, and the other side is more of a normal rhythm. So I want you to observe Christina's shoulder and how she can raise her arm up, and she doesn't have the winging we pointed out, and her scapula is rotating normally there, if you can appreciate that. She continues to work on her left side all the time.